Welcome in and thanks for joining us for another edition of TPI Talk. In this special edition, we will be coordinating with our publication that we do in the newspaper, our breast cancer awareness section, and we thought it'd be a great idea to supplement that with some interviews of people who do this on a daily basis and deal with different scenarios and things that are relative to the publication. So right now we want to welcome in a representative of Russell Medical, Dr. Mathieu Nader. Doc, thanks for joining us.
Thank you.
Well, I know you've been in the area for a little while now, but for those who are unfamiliar, could you give us a little background about yourself and how you ended up in Alex City?
Sure. I've been here at Russell Medical for about 3 years. Did my training in Louisiana and finished it up in Birmingham, and then made my way to Alex City. My wife has grew up in this area, and when the opportunity came to come back to work here, we're very excited about it, and have really enjoyed living here and being part of the community.
I got you. So what is your medical specialty, and how does that impact your role with Russell Medical?
I'm one of 2 radiologists here at the hospital, and we, all things imaging, we cover, whether it's something as simple as a chest x-ray all the way up to more complex exams like an MRI of the brain. We perform and interpret all those studies here at the hospital, both for the patients in-house and then outpatients in the community who come in to have tests done ordered by their physicians.
Gotcha. So again, in lieu of this month, October, serving as Breast Cancer Awareness Month, as a radiologist, how do you factor into the detection of breast cancer?
Well, we're on the front lines of cancer detection, right there with physicians who are performing physical breast exams in their offices. Many times on just the annual screening mammograms that we recommend for all women over the age of 40 years to have, we pick up cancers there that a doctor or the patient themselves may not have any idea that is there. So it's very important to get those annual screening mammograms done, along with your just routine monthly self-breast exams.
Gotcha. And so you mentioned the age 40, but let's say your family is somebody that you're going to carry that gene for. You come from that background.
Sure.
Is there an earlier age that you need to start doing
Absolutely. It really, that gets more technical and depends on when the age of the first diagnosis of breast cancer is in your family, and that's where your personal physician can come in to help with those recommendations. But without a history of breast cancer or immediate family history, that starts at 40 years old and should be done every year. And then kind of depending on trends, once you get up in age, depending on your other illnesses you might be dealing with, you might be able to space it out to every 2 years. But for most people, it's every year.
Gotcha. And so again, we're here with Dr. Mathieu Nader of Russell Medical, radiologist here. And Doc, you also, I was told that outside of just the screening portion of things, you also perform some specialty procedures. Could you enlighten us on that as well?
Sure. So the way, typically, if we find a suspicious, if there's a suspicious finding on a screening mammogram, we take it a few steps further. We do additional imaging, and if it's still a suspicious finding after those extra tests, we typically perform a biopsy. That can be done using the mammogram machine to guide the biopsy. In that case, it's called a stereotactic biopsy. Some people may be familiar with that term. The other option is doing the biopsy with an ultrasound to guide. It really just depends on where the lesion shows up better. Sometimes it's on mammogram, sometimes it's on ultrasound, but we do those very frequently, and that's the best way to figure out what needs to be done treatment-wise. If this is something that can just be watched, or if they need to take it a step further, seeing a surgeon, seeing a cancer doctor, and going that route.
I tried to do some homework prior to the interview. There seems to be an uptake in MRIs being done as well, and so is that something that trend-wise that you'll start to see in terms of breast cancer, really trying to zone in on that?
Yeah, MRIs come a long way for breast imaging, and it's especially helpful in cases where there's a high risk in a family history or a personal history. If there's certain, you hear about certain genetic mutations that put you at risk for breast cancer, that's where MRI can be helpful. Younger women with dense breasts, MRI, I mean, is a better choice than mammograms to see through that dense breast tissue and pick out a cancer that you might miss otherwise. So it's growing in popularity, and it's certainly useful.
Okay, and I know that Russell Medical prides itself on being on the cutting edge of technology. So, could you provide some insight to that as well as some of the things that are happening technologically here at the hospital?
Sure. Our women's center here at the hospital is we're constantly looking at ways to make it better. Right now, I feel like it's a great product overall as far as being accommodating to our patients' needs in the community. The staff that covers the facility is excellent, and because it can be a stressful process for women, particularly women with a history of breast cancer, to go through this every year, and we try to make it go as smoothly as possible. And hopefully in the coming year we'll be making some year or two some changes to make it even better, make it a better facility for everyone using it. And additionally, Russell Medical is partnering with UAB and the breast surgeons there, so that's a great resource for the people of the community to have that expertise available. And it's been so far it's been great working with those surgeons.
That's great to hear. And so there's this misconception at times that breast cancer is something that's exclusive for women, but 1% of all men will carry the trait or will possess breast cancer at some point. Could you just enlighten some of our male viewers on some things that maybe from a precautionary standpoint that they could be looking out for?
Absolutely. It's I saw a patient this afternoon with breast cancer, and he's a young male, and it can certainly happen. So the most important thing to do, I mean, we don't recommend annual screening for males, but certainly if there's a family history of male breast cancer or even female breast cancer, that's something to be aware of. And the biggest thing that you can do as a patient is just pay attention to your body. If you feel something abnormal, something that feels like a mass, or even just something you're not sure about, tell a doctor about it, because it might save your life.
Yeah, and as we get ready to wrap things up, that's something I wanted to get you to talk about as well, as for the individual out there who there may be some hesitation to want to get the screening because of the fear that they could be diagnosed. What would be your words of encouragement for them or suggestion for them?
I would say, it's very real to be stressed and fearful of the unknown and what might be going on in your body, but it's best to address it on the front end when a process is early in its development, because treatment of breast cancer has come such a long way that it's a very treatable disease now. But of course, the longer you wait, the more difficult it is to treat it. So the first hint that you have that something might be wrong, I strongly encourage people to act on it, and because we have great resources here at this hospital to take care of it, and it's a very treatable disease.
Sure. Dr. Nader, we sincerely appreciate you sitting down with us and enlightening us in the community on some of the things that Russell Medical has going on, and in particular kind of highlighting what this month is about. And again, for anybody who has that fear, you're in great hands here at Russell Medical, and they'll get you checked out. But that'll wrap up things here with this edition of TPI Talk. My name is Scott Hardy. See you next time.